For anyone who works with anxiety or PTSD patients, even with good therapy and medication, many patients still struggle. Therapy and medication help them manage better, but how much better could they be if you had other really effective tools? Many therapists end up in a neurofeedback course like ours because they've already asked that question. Medication helps some people, but many clients want alternatives. And even when medication helps, it often doesn't resolve the underlying pattern. And for many people, it's not a good long-term solution. That's often what brings therapists to a course like ours. The sense that there has to be something more. I'm Mike Cohen. I've spent nearly 30 years helping clients and clinicians learn tools that help their clients actually train their brain. Did you know you can use computers to train the brain to make healthier patterns? It's a bit of a strange concept when you first hear it. Your brain is a pattern machine. The tool of neurofeedback helps people get unstuck by training the circuits to fire in a healthier pattern. It doesn't take long for therapists who start using neurofeedback to observe the shift in their clients. Panic attacks that go away, mood that gradually stabilizes, clients gaining more control, quieting a racing mind. What therapists who add neurofeedback say consistently is that their clients start functioning better, and the clinician sees it happening right in front of them. Every one of your clients deserves that possibility. I wrote Neurofeedback 101 to explain what these tools can do in plain language for clinicians and for curious people alike. It sold over 13,000 copies. Over the years, therapists have walked up to me at conferences, people I've never met, and said, I got into neurofeedback after reading your book. I realized I could do so much more for my clients. The clinicians who come to learn this aren't looking for a new gadget. They're looking for something that gives their clients a real chance at functioning better, being less anxious, less overwhelmed, better sleeping, more emotionally balanced. If that's you, I encourage you to keep watching. The reason I got into this in the first place was because of my dad's situation. In 1994, he had severe agitated depression, what would now be called psychotic depression. He couldn't sit still. He couldn't watch TV, couldn't hold a conversation. He was an incredibly bright man who could no longer function. He was seeing a top psychiatrist at Vanderbilt Medical School. They tried medications, they ended up trying shock therapy, nothing worked. A holistic psychiatrist I happened to talk to suggested neurofeedback. I'd never heard of it. After researching it extensively, I got my mom to drive him 6 hours away to a small center in North Georgia. It was the closest place we could find at the time. After 6 days of intensive training up there, I came to visit him from Atlanta. My dad, who had been obsessing every waking moment, he was unable to engage, looked up when I walked in and said, "Oh, Mike, so good to see you. How's it going?" Well, that was pretty remarkable. He was actually starting to engage. It was kind of amazing. While I was there, I met a woman who had been a nurse in Vietnam. When she came back, she became a therapist, trying to work through her own trauma. She had flashbacks, pretty serious ones. Explained that every time she smelled damp earth and lived in South Carolina, where it rains a lot, she'd get triggered. She'd been to every trauma conference and done every kind of trauma work she could find. Nothing had broken that pattern. She described what happened in her 10th session of brain training called Alpha Theta, a protocol that specifically targets deeper psychological issues, stuff that's hard to get to. She found herself floating, watching the events that had happened to her. But instead of the usual reactive, hypervigilant response, she could just see it unfold from a distance without reacting. She reported that she was never triggered again, not once. My dad turned a corner too. 10 days didn't solve everything. He still needed more support, but it helped get him unstuck. It allowed some of the other approaches to start working, and that was a huge shift. He ended up doing quite well over time. Those two experiences are why I've spent the last 30 years doing this work. So many people need help. So what is neurofeedback actually doing? Your brain generates electrical activity every moment. That's what we call brain waves. Groups of neurons that are firing 1 time per second, 5 times per second, 20 times per second. When those patterns become dysregulated, when certain areas overfire or underfire, or two areas are not communicating efficiently, that can contribute significantly to anxiety symptoms and many other kinds of symptoms. Once these patterns get stuck, they're very hard to shift through talk therapy alone. That's often when medications are being used. But it's possible to retrain a stuck pattern into a healthier one. That's what neurofeedback does. Let me share 3 cases because each one reflects something different about what's possible. What I've watched happen in each of them is the kind of shift that's very hard to achieve through talk therapy, or at least it takes a long time, no matter how skilled the clinician. Elizabeth was 35, mother of a 2-year-old, and had struggled with anxiety since she was 17. By the time she came to us, she was having up to 5 panic attacks a day. They were taking over her life. She was on an antidepressant, but she wanted another child and was looking for an alternative to medication before getting pregnant. She had to talk herself into coming to each session at our office because her anxiety was that significant. After 12 sessions of training, she was experiencing no panic attacks. Much of her anxiety was resolved. She still had some anxiety, but it was far less and far more manageable. Medication was cut in half. I would have actually expected her to take longer to respond. This kind of case could take 20 or more sessions. We never really know how long it will take. She responded pretty quickly. Nicole was a 27-year-old nurse working in an intensive care unit. She'd worked for years as a waitress to put herself through nursing school. She had her dream job, and every single day she went to work, she had high anxiety and often a panic attack. She was taking Xanax before every shift just to get through the morning staff meeting. She knew she couldn't go on like this and was scared that being honest about what she was experiencing could jeopardize her career. A week after her first session, she noticed she was calmer. After her 3rd session, she felt calm enough to cut back her medication. After her 5th session, she had done so well, she felt like she could stop the neurofeedback and the biofeedback that we were doing with her. 5 sessions. She went back to work and was able to speak up in her daily staff meetings without panic. She was thinking more clearly and was much more confident with her patients. I want to be clear, that's an unusually fast response. Most cases take a lot longer, but her brain responded quickly once it got the right input. Sometimes that's how it goes. In this case, we also added biofeedback. Her nervous system just needed a nudge in the right direction. The 3rd case is a 13-year-old girl. Her mother, who was a very good therapist, brought her in. This girl had such severe anxiety that she was calling her mom from the school nurses station 10 times a day to come take her home. She also wouldn't use the school bathroom. Her mother had tried everything she knew, including medication. Nothing had really helped. Within 6 or 7 sessions, she started calling less. By around 12 sessions, she was down to 2 or 3 calls a week and was using the bathroom. Her mother couldn't believe the change. We did a few more sessions and then they stopped. She was doing well. 6 months later, right after the start of a new school year, she came back briefly for 3 or 4 sessions and then she was done. She was back on track. Sometimes the brain just needs a little help. Many of these clients are never given that option. This family and this mom found out about what we did, and it really changed things for her daughter. We see that regularly. So, in simple terms, how does neurofeedback actually work? Well, think about a child picking up a video game that they've never played before. How often do they ask an adult how to play it? Probably never. They just start. They get feedback, kind of points, that tells them that they're doing something right. They can't really explain how their brain is figuring it out, but they get better. They learn, adapt, adjust. They practice getting better and keep getting rewarded for moving in the right direction without even being aware of how they're doing that. Neurofeedback actually works the same way. We put sensors on the scalp, so you're really playing the game with your brain. We measure what the brain is doing in real time, and then we give the brain feedback, like points for producing healthier patterns. The brain doesn't need to understand it. It just learns to get more points. It gets better at it. These points might be rewarding circuits that help your brain be more calm or be less reactive, maintain better emotional regulation, circuits that help quiet your mind, even help you manage your attention or how you process information. Over time, with practice, the brain gets better at running those circuits the same way a child gets better at playing a game. This is the kind of thing that we teach you in the course: what circuits to target, how to reward the right patterns, and how to help your client's brain practice functioning better. For some clients, particularly those who have struggled for years without a clear answer, a brain map can be helpful. Think of the brain like a battery. It's electrical. Under normal conditions, the charge is relatively even across the whole brain. But if there's a hot spot or a low spot or an intermittent glitch in the signaling, it interferes with how well you navigate in life. In our course, we explain what brain mapping is, how it helps identify where the glitches or the hot and low spots are, and we review case examples and how it's used in a practice. You don't need to learn it to get started. You can always add it later. Many of our clients are relieved when they see their brain map. They've struggled for years, sometimes decades. When we review it with them, something shifts. It's no longer just psychological. There's something visible in their brain that helps explain why they've had such a hard time. That moment is often a powerful experience for them and for me. If what I've described resonates, I'd like to invite you to look into learning neurofeedback. We run a hands-on clinical training every quarter. It's designed for licensed clinicians who want to learn how to actually do neurofeedback, not just understand it theoretically. Targeting anxiety, how to target PTSD, mood, depression, ADHD, sleep, and more. This is fundamentally a hands-on course. Under my guidance, you'll do up to 5 neurofeedback sessions on yourself and on others. I'm very good at helping people feel what neurofeedback does to their own brain and at fine-tuning the training over 3 days so you actually see what kind of impact it has on you and others. That experience changes how you understand it, and it changes how you explain it to clients. You can't learn neurofeedback by reading about it. It's amazing when you do it. You'll also get structured guidelines so you can start using neurofeedback with clients if you choose to. We introduce multiple systems not to sell you anything, but so you can make an informed decision. We touch on brain mapping and introduce other neurotechnology tools that are powerful and realistic options. And we discuss the practical realities of integrating any of these into a clinical practice. In the course off hours, I spend time with anybody who wants to think through how this fits into what they already do. I've been fortunate to know hundreds of clinicians and how they've integrated these tools in very different ways. I'm glad to share that experience. We keep the group very small intentionally. Everybody who attends. We're really trying to make sure you get enough information that you're clear when you leave. If you get excited about helping clients, this is a great tool to learn. It lets you help people in such a completely different way. They're probably clients you're thinking of right now, and they deserve a clinician who's considered every available tool. This is one worth knowing about. Thank you.